As part of my job, what I do, I help local physicians in developing countries, mostly in Southeast Asia, India, Pakistan, to provide cost-conscious cure through bone marrow transplantation for children with mostly thalassemia, but also sickle cell disease. I originally come from Italy, where we had a lot of thalassemia, and in the past 40 years we have sort of accumulated experience on bone marrow transplantation. So we know what are the important things, what are not the important things, and we sort of know how to concentrate resources on important things. So getting rid of a lot of expenses which don't really have an impact on transplant outcomes, we are able to decrease transplant costs a lot. So, to give an example, in Europe, a bone marrow transplant for thalassemia will cost in the range of 100,000 euros at least. In India, we can do it for 12,000 euros, taking out a lot of unnecessary expenses. Of course, drugs are less expensive. Medical professionals, particularly nurses, are a bit underpaid, but that's the point. So we can offer it at a much lower rate than in Europe or US. In India, for example, the situation is changing. India is becoming less and less poor. It is not very difficult to raise the kind of money we need to perform a transplant. So we are almost at full capacity all the time. In the two units we collaborate with, one in Bangalore, one in Ahmedabad. In Pakistan, we're facing more problems. It's much more difficult because of the whole financial situation, political situation, to raise money. So it depends a lot on country by country. In Africa, we're trying to set up bone marrow transplantation programs, but it is more challenging. So we've not been very successful so far.